So there are basically three core practice skills that are involved. One of them traditionally was called focus concentration, but modern neurobiologists call it focused attention. And this is when we choose a certain object and we stay with it. It's what we were doing with the breath. Like, follow the breath. The mind may go out to other things, but let's bring it back to the breath repeatedly. Then there's mindfulness itself, which nowadays is called open monitoring by the neurobiologists. And this is what we did at the end of the practice this morning. Remember at the end when I said, now let's open to all the different channels and just see whatever arrives in all those channels? That's open monitoring. That's where we use the concentration we've developed in order to just see what's happening. And finally, there are acceptance and compassion skills, which, as it turns out, are absolutely critical in the clinical arena and are absolutely critical for cultivating forgiveness. So focused attention versus open monitoring, just to understand this distinction a little bit. Do any of you remember what cameras were like before they all had autofocus lenses? I know there'll be a time I ask this question and no hands will go up, but at least a few hands are going up. In those days, you had to have the skill of how to focus the lens. And if you didn't have that skill, you were going to be pretty much limited to impressionism, right? But once you had that skill, then you could take a picture of anything you wanted. It's very much that way in working with the mind. Most of the time, we spend the whole day talking to ourselves about ourselves. We're just lost in this thought stream. It is only by developing this capacity for focused attention that we have the higher resolution consciousness we need to observe the mind clearly. And that's what we do with these exercises where we pick an object like the sound of the rain or what's going on inside of us while we're following the breath. And we pick that object of awareness and we return to it over and over to refine this capacity to pay attention. Once we have that capacity, then we can open to whatever arises in the forefront of consciousness. And sometimes what arises will be an emotion. As you pointed out, it could be sadness, but it could be fear. It could be joy. It could be sexual arousal and interest. It could be, some kind of subtle, sublime appreciation. It could be any one of could be gratitude. Could be any one of a wide range of feelings. But what happens is we spend this time stepping out of the thought stream and paying attention moment to moment to sensations in order to develop the capacity to then open to the rest of our experience, to be able to feel what we feel. And this acceptance component is particularly important as there have been so many studies looking now at mindfulness for clinical interventions. There have been a lot of studies designed to dismantle mindfulness, meaning figure out what components are actually most valuable. And the most valuable component for clinical change is this dimension of acceptance. And this picture here is to help you understand the meaning of acceptance here. I want you to join me in looking at him, okay? And I want you to notice what you feel as you look at this puppy. What do you feel in your heart as you look at this puppy? And raise your hand if your dominant feeling is harsh critical judgment. If so, let's talk after the workshop. Most of us look at him and we feel something like the universal sound of compassion and connection, which goes something like this. Oh, right? And it's interesting. Different cultures have slightly different sounds, but it's all pretty similar, right? Oh. Now, this is why we talk about mindfulness practice as puppy training. Even if he were to pee and poop at the wrong time or not listen to instructions, we would think he's young, he needs love, he needs training. You've already seen from our practice this morning that the mind does pee and poop at the wrong time. The mind does not listen to instructions. It's all over the place. The attitude we would have toward this puppy is the attitude we're trying to cultivate toward the mind. This is about, I was just leading a mindfulness retreat in Spain, can't believe it, just 10 days ago, and came to the conclusion that there's basically three principles to guide the retreat. Acceptance, acceptance, and acceptance. It's like the old joke about real estate. What are the factors that determine a house's value? Location, location, and location. The same is really true here. This is all about, can we find a way to open to and accept experience? And this acceptance dimension is going to be the critical dimension for harnessing this for forgiveness.